Hi, my name is Jane Gray, and today I will be discussing ADHD as the topic for my disorder presentation. ADHD. ADHD stands for Attention Deficit Hyperactivity Disorder. According to psychiatry.org, ADHD is one of the most common mental disorders amongst children. It is known to be chronic and debilitating, and it impacts individuals in many aspects of their life, such as difficulties with academic and professional expectations, struggling with social skills, and troubled parent-child relationships. Children with ADHD can suffer from poor self-esteem and impaired social functions if not treated properly. ADHD is usually first identified in school-age children once it leads to disruption in the classroom or problems with their schoolwork. The Center for Disease Control states that according to a national survey of parents using data from 2022, an estimated 7 million children aged 3 to 17 years old in the United States have ever been diagnosed with ADHD. That number of children is 11.4% of the children in that age group. According to the National Institute of Mental Health, the prevalence of children diagnosed with ADHD increased 42% between 2003 and 2011. Males have a consistently higher prevalence of ADHD than females do. However, although males are diagnosed more frequently, they are not more likely to have ADHD than females. However, they are more likely to present signs of ADHD, showing more hyperactivity or external symptoms, whereas females tend to have more inactivity. The median age of onset for children with ADHD is 6 years old. And approximately 1/3 of the children who are diagnosed with ADHD will retain this diagnosis into their adulthood. ADHD has quite a few symptoms. It's recommended that you don't jump to conclusions when trying to diagnose, let's say, children, friends, or even yourself, as symptoms of ADHD are often shared symptoms of other disorders that may be one and the same but aren't necessarily ADHD. According to the Center for Disease Control, children with ADHD may have symptoms such as frequently forgetting things or losing items, frequent daydreaming, excessive squirming or fidgeting, hard time resisting temptation, excessive talking, making careless mistakes or taking unnecessary risks, trouble taking turns and maybe bumping into the counter if they turn too soon, and difficulty getting along with others. Based on the type of symptoms displayed, there are 3 kinds of presentations of ADHD. The first one is predominantly inattentive presentation, which is an individual who maybe has trouble organizing or finishing tasks, trouble paying attention to details or following instructions or conversations, and this person may easily be distracted or forget details of their daily routines. The second one is predominantly hyperactive presentation. This person fidgets or talks a lot. It's hard for them to sit still for long periods of time. Children may run, jump, or climb constantly. They may suffer from feelings of restlessness, have trouble with impulsivity. They may interrupt others a lot, grab things from people, or speak at inappropriate times. And they may also have a hard time waiting their turn or listening to directions. And lastly, we have predominantly combined presentation, which, as you can probably assume from the name, is someone who typically suffers from both types of symptoms. According to the Mayo Clinic in adult ADHD, hyperactivity may decrease, but other symptoms like impulsiveness, disorganization, problems with prioritizing, poor time management, problems focusing on tasks, low frustration tolerance, frequent mood swings, or trouble coping with stress may continue. The exact cause of ADHD is not clear, however, research efforts do still continue. Without a sure cause, researchers have been able to come up with some theories for possible factors of ADHD, such as genetic factors. ADHD can run in families, and studies actually indicate that genes may play a role. Another one is environment. Certain environmental factors also may increase risks, such as lead exposure to children. And lastly, problems during development. Problems with the central nervous system at key moments in development may also play a role, especially in cases of like prenatal development where the mother may have drank or smoked or partaken in drug use while pregnant. The types of treatment for ADHD vary by age group and include behavior therapy and medications. To find the best options for children, it is recommended that parents work closely with others involved in their child's life, such as teachers, coaches, and other family members. The American Academy of Pediatrics recommends parent training in behavior management as the first line of treatment for children ages 6 years or younger. For children diagnosed who are 6 years or older, recommendations include both medication and therapy, including behavioral classroom interventions and school support. Treatment for adults are still similar. They include medications, psychological counseling, and treatment for any mental health conditions that occur along with ADHD. And lastly, I'd like to go in more depth on the different treatments for ADHD. First, we'll go over therapy. AAP recommends behavioral classroom intervention and school support. The goals of behavior therapy are to learn and strengthen positive behaviors while also eliminating unwanted or problem-causing behaviors. Class management training encourages positive behavior through a reward system or daily report cards while also discouraging negative behaviors. And on the other hand, we have organizational classroom training, which teaches children time management, planning skills, and ways to keep their school materials organized in order to optimize a better learning environment and reduce distractions. Both of these strategies require trained staff, such as teachers, counselors, school psychiatrists, to follow specific plans to teach and support behavior. Lastly, we have medication. Medication can help children manage their ADHD symptoms in their everyday life and can help them control the behaviors that cause difficulties with their family, friends, or school life. First, we have stimulants, which are the most widely used across America and globally. Between 70 and 80% of children with ADHD have fewer ADHD symptoms when taking these fast-acting medications. Secondly, we have non-stimulants, which were approved for treatment of ADHD in 2003. They do not work as quickly as stimulants, however, their effects can last up to 24 hours, whereas stimulants usually range between 4 to 8 hours depending on the dosage. Medications can affect children differently and can have side effects such as decreased appetite or sleep problems. One child may respond well to one medication, while another child may not. This is why it's important to keep your physicians, school teachers, counselors involved in the education and the development of your child in order to ensure that you are taking the best steps possible to create a better life for those with ADHD. Thank you for listening to my presentation.